staff. Our correspondent Dan Johnson has the latest.
This is Luca De Nicola, described by his family as a strong and healthy 19-year-old. He was a chef from Italy living in London. His brother posted this picture of them together saying, "I will express your wishes and fulfill your dreams." After feeling ill for a week, Luca died within half an hour of arriving at hospital. And this is the fundraising effort to support another grieving family, mourning the loss of 13-year-old Ismail Mohammed Abdul Wahab, a son they couldn't even say goodbye to. It's already reached £47,000. Ismail was admitted here at King's College Hospital in South London on Friday with breathing difficulties. His family says he was given ventilation and put into an induced coma, but 3 days later he died, isolated, on his own, despite his family saying he had no underlying health conditions. Their statement ends, "We are beyond devastated." Another stark illustration of the capacity of this virus to quickly claim the lives of even the youngest and fittest.
They are really sad reminders that it doesn't matter what age you are, you should be staying at home and observing all the social distancing measures that we have highlighted.
And that was also underlined by the latest figures. 381 deaths in the UK in the last 24 hours, the highest number on one day so far. The official death toll has reached 1,789 in total, with more than 25,000 confirmed cases now across the UK. But how reliable are those figures when testing remains relatively limited? Around 8,000 people a day are being tested for the virus. This is one drive-through centre for NHS workers in England, but it's only a limited trial, and the government is still way off its ambition to test 25,000 people a day. That's a big frustration, especially when a quarter of doctors are off sick or isolating at home, not knowing if they're safe to return to work.
I think they're feeling fear. They're feeling frightened. They don't know. Everybody in the country is feeling fear, and doctors and healthcare workers are no different. They're not sure what is around the corner. They're not sure if they're going to be protected when they go to work, and they're not. I think increasingly they're not sure that they are fully believing what the government is telling them.
So what's going wrong? Well, the government has admitted for the first time some problems making more tests available.
We want to increase the number of tests. We are increasing the number of tests. I mentioned earlier that one of the constraints on our capacity to increase testing overall is supply of the specific reagents, the specific chemicals that are needed in order to make sure that tests are reliable. It's also the case, as I'm sure you're aware, that we've been working with the private sector and with academics, and Boots, for example, have increased the number of drive-in centres for NHS and frontline workers to be tested.
Last night, the chemicals industry said they are being produced and delivered to the NHS. But it may be some time before we know just how widespread the virus really is and how much worse things may get. Dan Johnson, BBC News.